Let's proceed to Zang visera with the heart and pericardium. The Zang visera is a collective term for the heart, the lung, the spleen, the liver, and the kidney. Although each has its own physiological function, under the guidance of the heart, the functions of these five organs are interdependent and cooperate to maintain all the normal vital activities of the body. The heart is located in the thorax above the diaphragm. It is surrounded by the pericardium. In Chinese medicine, the heart is the house of the mind, the master of blood, and the governor of the vessels. Among the five elements, it belongs to fire. Complemented by the other Zhang organs, it has the function of controlling all the vital activities of the body. Thus, the plain question states, the heart is the lord of all organs. It is where the spirit arises. Now let's go to its physiological functions. First, the heart is the governor of blood and the governor of blood vessels. Mastery over blood has two meanings. First, the heart takes part in the formation of blood. Secondly, the heart promotes the circulation of blood. The heart beats continually, propelling the blood through the vessels so that all the organs and tissues receive nutrients and can maintain their normal vital activities. This is why the heart is known as the organ of motive force for blood circulation. In Chinese medicine, it is the heart's qi that enables its normal beating and that provides the motive force for the circulation of blood. The blood that is controlled by the heart is called the heart blood. By the theory of yin and yang, qi belongs to yang and blood to yin. This is the reason for the terms heart yang and heart yin. Coordination of qi, blood, yin, and yang of the heart maintains a relative equilibrium of normal physiological activities in the body. Mastery over the blood vessels also has two meanings. First, structurally, the heart is connected to the blood vessels. Secondly, the vessels are the passages through which the blood is propelled by the heart. These vessels deliver the blood to all parts of the body. The heart controls the vigor of this flow, and the degree of this vigor can be judged directly from changes in the pulse profile. These two functions of the heart are intimately and inseparably related. Only when the heart qi is sufficient can the heart keep the blood flowing normally within the vessel. Mastery of the heart's function is normal or not can be examined objectively by the pulse profile, the complexion, and other findings. For example, when the heart qi is abundant and the blood full, so that the heartbeat is strong, then the blood will flow smoothly. This is manifested as a regular pulse that is forceful at an even rate of 4 to 5 beats per breath and a red and lustrous complexion. Conversely, if the heart qi and heart blood are insufficient so that the heartbeat is weak, then the pulse is irregular and thread-like or feeble, and the complexion is pallid and lusterless. If the heart blood is stagnant, then there may be such symptoms as dusky complexion, cyanotic lips, palpitation of the heart, tightness in the chest, precordial pain, and a pulse that is hesitant and intermittent. Here is an illustration showing the physiological functions of the heart. That the heart governs the mind, it governs consciousness, thinking, responsive activities. The heart is the motive force of blood circulation. It has an exterior-interior relationship with the small intestine, and it governs the blood vessels. It has its outward manifestation in the face, opens into the tongue, controls sweating, and controls the apical pulse. The heart is the governor of mind. This function is also known as the heart housing the mind. In Chinese medicine, the term vitality has a broader meaning and a narrower meaning. In the broader meaning, it is the outward activities of the life of the whole body. It encompasses the body's complete form and function, including its complexion, expression of the eye, speech, response, movement of the limbs and trunk, etc. In the narrow sense, vitality is the mind that is governed by the heart. It encompasses the spirit, consciousness, thinking, and related activities. Modern physiology holds that all these mental activities are attributed to the physiological functions of the brain. and these are a response of the brain to the external objective environment. In Chinese medicine, these mental activities are attributed to physiological functions of all five of the Zang visera. The plain question states, the heart houses the mind, the lung houses the soul, the liver houses the ethereal soul, the spleen houses intention, and the kidney houses the will. Through the activities of the mind have to do with all the five Zang organs, principally they are controlled by the heart. Apart from the influence of ancient philosophical thought, this conclusion is mainly based upon clinical experience. First, the blood is the material support for mental activities. Second, mental disorders are usually cured by methods of treating the heart. The heart's physiological functions of governing the mind and governing blood and blood vessels are closely interrelated. Because blood is the material support for mental activities, when blood is full, the mind is nourished. Only then are the mental activities normal, so that the person is alert, consciousness is healthy, thinking is quick, and responses are prompt. The body then maintains a healthy balance with the external world. Conversely, if blood is insufficient, the mind loses its nourishment. This may be manifested as the spiritedness, low responsiveness, insomnia, and excessive dreaming, forgetfulness, and restlessness, and related symptoms. If there is heat in blood, the mind may become deranged, manifesting agitation, delirium, and even loss of consciousness. The heart's function depends upon the coordinated action of heart qi, heart blood, heart yin, and heart yang. In general, the heart's control over blood and the blood vessels depend upon the heart qi for motive force and upon heart yang for warmth. Heart qi promotes blood circulation and prevents blood stagnation, and heart yang warms and activates blood to avoid stasis due to cold. The heart's control over the mind depends upon an adequate supply of the heart blood and heart yin. If heart blood and heart yin are insufficient, yin blood fails to nourish the mind, resulting in such symptoms as agitation, delirium, and dream-disturbed sleep. If heart qi and heart yang are injured, heart blood may become static, resulting in such symptoms as tightness in the chest, palpitation of the heart, pain in the heart, and cyanotic lips and tongue. Thank you for your attention.